Welcome to Transitional Work, Keeping Injured Employees Working and Productive. Hi, I'm Shauna Dunbar. I am a public health nurse and specialize in occupational health nursing. While registered nurses help one person at a time, a public health nurse enjoys working with entire populations to reduce the risk of disease and improve health. As an occupational health nurse, the population I work with are employees. At Workplace Health, we strive to improve employee health and productivity. Today we are going to cover the following topics. What is a work injury, workers' compensation benefits, healthcare providers, and transitioning back to work. What exactly is a work injury? The legal definition involves determining AOE/COE criteria, meaning the injury has to arise out of employment during the course of employment. What that means is the injury needs to occur when the employee is actually working, doing tasks that are required on the job. So if that's a work injury, what is not a work injury? Generally, workers' compensation does not cover things like stress or a psychiatric disorder, or someone who simply just happens to feel pain while they are working without a specific mechanism of injury. That is why it's so important to report any incident that you have right away. If someone intentionally hurts themselves, that is not covered, or if they are involved in fighting or getting injured, horsing around while they are at work. Also, commuting to and from work is not generally covered. Now, of course, we hope you have safe work practices and hope not to have any work-related injuries that would occur. But accidents can happen, and your employer wants to be sure you know just what to do. This slide outlines the steps. The most important thing is to report it to your supervisor right away. In fact, report any incident right away, whether you feel you are injured or not. If first aid can be done at the employer's facility, they will do that. If you have a true medical emergency, then 911 will be called and you will be transported to the nearest hospital emergency room. If you need to seek medical treatment beyond first aid, be sure to see an Ohio BWC certified provider. These providers know to follow the BWC rules, and you are less likely to have complications with your claim. If your employer is part of a drug-free workplace program, you will need to submit to a post-accident drug and alcohol test. Of course, there is paperwork too. You need to file paperwork to get your workers' compensation claim filed and to be sure management is aware of the injury. There is an incident report to complete. Finally, be sure that you understand your employer wants you to stay at work as much as possible. Your employer needs to know what happened if you do need medical care. If there are work restrictions, your employer can work with you to be sure you get back to work quickly and safely. Good and timely communication between the worker and employer is essential to avoiding conflicts and complications with workers' compensation. Workers' compensation is an insurance system that does have benefits associated with it. Of course, the claim must be compensable in order for the benefits to kick in. Remember that workers' compensation is a no-fault insurance system. No attorneys need to be involved to determine who is at fault, especially if there is no dispute. If the injury occurred at work and is compensable, then the benefits are automatic. Benefits include paying for the cost of medical treatment like provider visits, x-rays, and therapy, and paying for lost time from work. It is important to know that there is a 7-day waiting period for any lost time benefits, and these are generally not paid. So if you agree to participate in a transitional work plan, you will not lose time from work and will not lose out on your usual pay. Who does what in workers' compensation? First, the Ohio Bureau of Workers' Compensation will determine which medical conditions are allowed as part of the workers' compensation claim. The Managed Care Organization, or MCO for your employer, is the company who manages and improves the medical care. Your employer works closely with the MCO to be sure employees get the care they need in a timely manner. Your employer may also have a TPA or third-party administrator that will assist with the claims management. The specific MCO and TPA who works with your employer are listed on the handout provided. In the state of Ohio, injured workers can seek medical treatment with any medical provider of their choosing. However, most employees need some direction on where to go for treatment. Therefore, your employer has established a list of preferred healthcare providers. They are local, Ohio, BWC certified, and they understand how the insurance benefits work. So you will have fewer issues with the claims process using these providers. During normal business hours, there are occupational health clinics who have a special expertise in managing and treating work-related injuries and illnesses. Urgent care facilities are local providers who often have extended hours. And the hospital emergency department is where to go in the event of a true emergency for care that is offered 24 hours a day, 7 days a week. Transitional work is a worksite program for those employees who are returned to work with physical restrictions. It is a program that helps to progress workers back to their usual and customary job as quickly and safely as possible. It is time limited and can be individualized based on the injury itself. Not unlike how a Major League Baseball player steps down to the minor leagues while they are rehabilitating, in a transitional work program, the employee remains at work so they can rehabilitate while they are performing some of their job duties. Some of you may be familiar with the term light duty, when a worker is on restrictions. This is a similar concept, but transitional work is focused more on transitioning that employee back to their usual job duties, because of course we expect everyone to return to their regular job as quickly and safely as possible. There are many benefits to participating in transitional work. The worker experiences a smoother transition back to their usual job. Workers continue to receive a full, regular paycheck. Their job skills stay current, and they maintain their work relationships, which really does help them return to their regular type of work faster. Because the worker is rehabilitating on the job, healthcare costs go down. Those workers have a sense of accomplishment and productivity since they remain fully employed. They don't decondition sitting at home, so their health is optimized. The bottom line is the injured worker will recover more quickly when they participate in a transitional work program. As we wrap up, let's look at some of the frequently asked questions. How long can an employee be in a transitional work program? Employees in the program are evaluated every 30 days, but an injured worker could be on restricted duty for just a couple of days or for as long as a month or two. Is it possible to do rehabilitation on site? Well, there are two ways to look at this question. One is that being on work restrictions, as we have mentioned, is rehabilitating the employee on the job while they're working and preventing deconditioning. The second way is if a physical therapist comes to the work site to evaluate and treat the injured worker with specific modalities that address the problem he or she might be having with the job. The Transitional Work Program allows for this kind of assistance as well. What if the employer cannot accommodate a specific restriction? Then the employee does remain out of work and is generally entitled to temporary total disability benefits. If an employee refuses to do the restricted work that is offered, then the employer is generally not obligated to pay disability benefits. I want to thank you for your attention to this presentation about rehabilitating an injured worker back to their usual and customary job using a transitional work program. If you have any questions, please talk to your supervisor. I hope you have a safe and healthy workday.